Okay, so back in January, I did an evaluation on a boys basketball player, and overall, I had taken a fairly good history, and it was just a little unorganized. But for the most part, I had great questions. I asked what I needed to ask, and I went into detail with some things. Um, she said that I needed to palpate with more intent and not tap fairy fingers, because back then I had an issue with lightly touching their ankles or whatever I was evaluating, and I have recently fixed that, so I no longer have fairy fingers. I did a good job noticing that he had pes cavus and that his Achilles curved. I think she was a little surprised I actually looked for that compared to, I guess, other people. I don't know. She just thought that that was a good thing that I looked for. She was glad that I did both active range of motion and passive range of motion because, well, we had issues with using goniometers and things like that, but I had overcome it and I did it without being told, and I think that was pretty good. Um, she said I did well on manual muscle tests as well, so I did what I was supposed to do with that. I did the fibularis group, anterior tib, posterior tib, and the digits. She thought that I could have done more special tests, which I could have because I only did 4. Um, I had tunnel vision, which is a huge issue, but that's things I've worked on since then too, so that's pretty good. I just had issues with rolling things in and rolling things out. I shouldn't have jumped to the conclusion of Achilles tendonitis because it wasn't. It was acute, not chronic. But eventually it turned chronic, so my original diagnosis was correct. But at the time, I had to say that I thought it was a gastroc strain because it was acute, not chronic. But it progressively got worse over time, so it turned into Achilles tendonitis. So we had to treat him for that. She said overall it wasn't a bad evaluation. I just need to work on organization, palpations, and special tests to help roll things in, roll things out, and avoid having tunnel vision. But for the treatment, we had him do some stretching because his range of motion was really lacking in pretty much all areas. It was kind of even worse on his uninjured side than it was on his injured side, which I thought was kind of weird because it wasn't even his dominant foot that had the lack of range of motion. No, it was his dominant foot that had lack of range of motion. I just thought that was odd. So we really worked on stretching and then doing some ankle pumps and BAPS board. We also did some hamstring stretches and a long sit calf stretch because he was just super tight all the way around. That kind of goes in with the kinetic chain, I think. So he was kind of a difficult case because he had foot inserts, like orthotics, that he was supposed to wear, but he continued not to wear them because they hurt his feet. He just wouldn't give it enough chance to like get used to it that he just quit wearing them. So it got to the point where she told him that he couldn't play unless he had the orthotics in his shoes because it was just causing so many issues for him since his arches were so high. It wasn't a good thing for him. But overall, like I said, she thought it was a good evaluation. I just had some things to work on, and I have recently worked on them, so I think I'm making good progress, and that's what I really want to do. Apparently this video is going to be a lot like my evaluation was. It's a little unorganized. Anyways, so going back to why I only did certain special tests and why I get tunnel vision, I guess. I only did certain ones because I believe that's all I needed to do. I did the Thompson test because I wanted to check for a rupture, even though I didn't really think there was one. I just wanted to make sure. Inversion talar tilt and eversion talar tilt, I wanted to check for maybe an ankle sprain because he had pain kind of around his Achilles, but it was also on the lateral side, kind of like PTFL. So I wanted to help kind of roll that out. I found out that it was painful, but that was just where my thumb was placed. So it was negative. The single leg calf raise, he couldn't complete it due to pain. And I was kind of expecting that because he had a 7 out of 10 with activity, and without it was a 5. So he was in a decent amount of pain. Reason I jumped to Achilles tendonitis was because I didn't know what else to call it. I knew he had an issue with his Achilles, but I didn't think about the bigger picture and what the Achilles was made from, I guess you would call it. So that's where I had to get the gastrocnemius strain. And then my issues, or my weaknesses, I should say, and how I'm going to fix them, or I have fixed them. I really do well with feedback. So with Amy telling me all the things I needed to work on, I've worked on them, and I feel like I keep that in the back of my mind during every evaluation, that I need to palpate with intent and I need to structure my histories. But those have come just from practice. Like, if you practice it enough in the right way, you're gonna have more organization and things like that. So I think practice really helps. Feedback for me really helps. So with the other things, like needing to not have tunnel vision, I believe I've gotten better with that, but not fully. Like I said, I just need to do more special tests to help keep from getting tunnel vision. I need to roll things out, roll things in better. So special tests will help with that. I try not to jump to conclusions when I hear history. And that's just really hard because we're taught that certain things you need to listen for because it could possibly be this. So you listen for that thing and you're like, oh, I need to do this special test. And then it's positive and you're like, oh, they have this certain thing. And I need to stop doing that. I need to think of it holistically instead of just one certain area. And Jamie has really helped me with that too when she's teaching Kylie. Because I think that it's just a normal issue for people. So having Jamie help think of it as like a holistic thing, not just this certain body part, I think that really helps. So having other preceptors there to teach you instead of just having one preceptor is really helpful because they've all seen different things, they all experience it differently, they teach it differently, and I think that really helps along with the feedback.